Welcome to the Deep Dive, where we cut through the noise to get to the clearest, most impactful insights. Today, we're plunging into something really fundamental, something we often take for granted. The human body's incredible framework, your musculoskeletal system. It's wildly complex, astonishingly adaptable, and, well, frankly, absolutely essential.
Exactly. Our mission for you today is to kind of pull out the most important nuggets of knowledge from a detailed medical assessment chapter. We want to turn what could be pretty dense information into something truly understandable and insightful. Think of this as your shortcut to being well-informed about the very bones, joints, and muscles that make you, well, you.
All right, let's unpack this. Let's start right at the foundation, our bones and their core functions. When we talk about bones, you might picture something, I don't know, inert like a statue. But that couldn't be further from the truth. They're incredibly dynamic, actually, a constant hive of activity. For instance, did you know your body has specialized cells called osteoblasts, which are busy building new bone, and then osteoclasts, which are constantly breaking down old bone? It's like a never-ending cellular construction site.
It truly is a remarkable remodeling process. And this constant activity is crucial for so many vital processes. Bones aren't just a rigid scaffold, you know. What's fascinating here is that they're also the site of hematopoiesis.
Hematopoiesis.
Yeah, that's your body's own blood cell factory, specifically happening in the red bone marrow. And here's a mind-boggling fact for you. A staggering 99% of your body's calcium comes directly from your bones.
99%, wow.
Plus, there's a hormone called calcitonin that acts almost like a bouncer at the calcium party. It plays a direct role in decreasing serum calcium levels, keeping things balanced.
So if you could actually peer inside one of these dynamic structures, what would you see? It's not just solid rock, is it?
Not at all. Think of a bone, maybe like a reinforced concrete building. The outer walls, that dense, compact outer layer, that's called the cortex. It gives it immense strength. Yeah. But inside, it's surprisingly airy, almost like a honeycomb. That's your inner medulla with its spongy tissue.
Okay.
And within that softer cancellous tissue, you find these large spaces filled with both red and yellow marrow. And what's often overlooked is just how vascular bone is. It has a really rich blood supply, which is key to all that cellular activity we were just talking about.
That rich blood supply definitely makes sense for such an active tissue. So how do we even begin to classify all these different bones in our body? There are so many.
Well, we often categorize them by shape and function. It makes it a bit simpler. For example, you've got long bones, like your femur in your thigh. They're cylindrical, and typically the ones bearing most of your weight.
Right, the big ones.
Exactly. Then you have short bones, like the phalanges in your fingers and toes. They're small, bear little or no weight, but they're absolutely crucial for dexterity and fine movement.
It truly makes you see our bones, not just as static scaffolding, but as these incredibly dynamic, multitasking powerhouses. They're doing so much more than just holding us up.
Right.
Beyond providing that essential framework and support for all the surrounding tissues, they're active partners in movement. They allow us to bear weight. They're also your body's built-in armor, protecting vital organs, which is huge. And as you mentioned, manufacturing blood cells. And last but not least, they serve as crucial storage units for various essential minerals. It's quite a resume for our bones.
It really is. And the magic doesn't stop there. What's fascinating, I think, is how these various elements work together in this delicate balance to maintain bone health throughout your life. Think of it this way.
Right.
Your bones are constantly being rebuilt and remodeled. It's a never-ending construction project.
Right.
And it requires a whole symphony of minerals and hormones working together. We're talking about calcitonin, calcium and phosphorus, vitamin D, parathyroid hormone, growth hormone, estrogens, thyroxine. The list goes on.
What?
And just one missing instrument, like, say, not enough vitamin D, and the whole orchestra can fall out of tune. It impacts everything from your energy levels to your risk of fractures. It's a prime example of the body's incredible yet really delicate balancing act.
That's a powerful way to put it, an orchestra. And just like any complex system, bones are constantly changing, especially as we move through different phases of life, aren't they? The source material highlights that bone mass naturally decreases with aging. That's a really critical point because it predisposes individuals, particularly older women, to injury.
Absolutely. And beyond just that decreased bone mass, aging brings several other significant musculoskeletal considerations. There's osteopenia. That's a decrease in bone density that isn't quite osteoporosis yet, but it's on the way.
A precursor, sort of.
Exactly. and changes to the joints and the cartilage themselves. You might also notice a decreased range of motion, or ROM. That's simply how far you can move a joint. Also, a curvature of the spine known as kyphosis. That familiar hunched posture some older people develop.
Yeah.
There's also muscle atrophy, which is basically muscle wasting, and just a general slowing of movement.
And if we connect this to the bigger picture, all these changes naturally raise pretty significant safety concerns, right? Impacting mobility, independence.
For sure. It makes you want to immediately stand up straighter just thinking about it, doesn't it?
It does. So, if bones are the framework and growth and aging affect them, then joints and muscles are really the connectors and movers that bring it all to life. Let's talk about joints first. They're simply the locations where two or more bones come together, and they're different types based on how much movement they allow, right?
Exactly. And of these, the ones we call synovial joints, they're most often affected by disease, which makes them very important clinically. They're characterized by having a synovial membrane and synovial fluid. That fluid helps lubricate them, reduces friction, kind of like oil in an engine.
It makes sense.
You also find bursa at joints. These are small sacs lined with that same synovial membrane, acting like little cushions between moving parts.
Okay, cushions.
And when we look at their structure, their anatomy, you have common subtypes. Like the ball and socket joints, think shoulder and hip, allowing for really wide-ranging movement.
Right, lots of motion there.
Then you've got hinge joints, like your elbow, which work pretty much like a door hinge, back and forth. And condylar joints, like your knee, which allow for a combination of movements a bit more complex.
Okay, here's where it gets really interesting for me. Seeing how all these distinct parts collaborate to create every single movement we make. Then you have the muscles, the power behind all that movement. We have three main types. Smooth, like in your digestive system.
Right, involuntary.
Cardiac, that's your heart muscle, obviously crucial. And then skeletal muscles, which are the ones we consciously control to move around. For movement, we're mostly talking about those skeletal muscles. Their individual fibers are held in place by connective tissue, bundled up in structures called fasciculi, almost like wires in a cable.
That's a good analogy. And supporting these muscles, you have tendons and ligaments. People often confuse these two. Tendons are that tough, fibrous tissue attaching muscles to bones. They transmit the force of the muscle contraction so you can actually move the bone.
Muscle to bone, got it.
Ligaments, on the other hand, attach bones to other bones at the joints. They provide crucial stability. Think of them as strong, elastic bands holding your skeleton together, keeping things aligned.
Okay, tendons move, ligaments stabilize. That helps clarify it. So, given all this intricate complexity we've just discussed, assessing musculoskeletal health obviously requires a truly comprehensive approach. It starts, as it often does in medicine, with gathering information through a thorough health history. This includes the patient's general health history, their nutritional history, because, like we said, what you eat deeply impacts bone health.
Hugely important.
Family history, any genetic risk factors, and of course, their current health problems, what's bothering them right now.
Right. And from there, it moves into observing and examining. A general inspection would look at posture, gait, that's how someone walks, and their overall mobility, just watching them move.
Okay.
Then there's a functional assessment. Does the patient use any assistive devices, like a cane or a walker? And what's their ability to perform activities of daily living, or ADLs?
ADLs. Those are the everyday basics.
Exactly.
Yeah.
Everyday tasks like dressing, bathing, eating, getting around the house. The physical examination itself involves inspecting the area, palpating, that's carefully feeling for any abnormalities, tenderness, swelling,
Play around, yeah.
and checking the range of motion for the relevant joints. You might even see rehab therapists using a tool called a goniometer. Think of it like a specialized protractor for your joints.
Oh, interesting.
Yeah, they use it to precisely measure flexion and extension angles, how far a joint can bend and straighten.
And a really, really crucial part of this assessment, especially if there's been an injury, is the neurovascular check, right?
Absolutely critical. You always compare side to side, and you actually start with the injured side to establish a baseline for comparison.
Makes sense. So what does that involve?
The assessment involves palpating pulses below the level of the injury,
Right.
making sure blood flow is good, and checking sensation. Can they feel touch? Movement, can they wiggle fingers or toes? Color and temperature of the skin, is it warm, pink, or cool and pale? And of course, assessing pain in the affected part.
And sometimes, if pulses are difficult to find just by feeling, a Doppler might be needed.
Exactly. That's a handheld device that uses sound waves to detect blood flow when a pulse is faint or maybe absent to touch.
Gotcha. And what about muscle strength itself? How is that measured?
Well, To quantify muscle function, there's a common scale we use for grading muscle strength.
Mhm.
It's pretty straightforward. A 5 means normal strength against full resistance. A 4 is good, movement against some resistance. 3 is fair, movement against gravity only. 2 is poor, movement only when gravity is eliminated. 1 is just a trace, like a flicker of contraction.
Yeah.
And 0 indicates no evidence of muscle contractility at all.
That's very clear. But, beyond the purely physical, a comprehensive assessment has to dive into the psychosocial aspects too, doesn't it?
Absolutely. And this raises such an important point. Understanding the musculoskeletal system isn't just about the bones and muscles themselves. It's really about how its health, or lack thereof, profoundly impacts an individual's entire life and well-being.
That's a powerful point. It really underscores how seemingly maybe localized biological changes can have this huge domino effect on someone's entire quality of life and their independence. Because problems with the system can affect employment, right? Lead to disabilities.
Yeah, sure.
And often result in chronic pain, which, as we know, can bring on anxiety or depression. It can cause significant stress, can impact body image and self-concept. I mean, think of someone who's had an amputation and is adapting to a whole new reality, a new body. So it's also vital to identify their support systems. Who do they have? And determine if maybe counseling might be needed for that mental and emotional toll.
That holistic view is just essential for proper care, for truly understanding the patient's experience, and to get a deeper insight into what's actually going on beneath the surface with these complex issues. Medical professionals turn to various diagnostic assessments. This includes a range of laboratory tests, things like serum calcium and serum phosphorus, those key minerals for bone health we mentioned,
Right.
alkaline phosphatase, which is an enzyme that can indicate increased bone growth or breakdown, and specific serum muscle enzymes like creatine kinase or CK. CK levels can be elevated when muscle tissue is damaged.
So what does this all mean for getting a diagnosis? These labs, these tests, they're like the windows and tools that let medical professionals truly see what's happening beneath the surface, sometimes without even making an incision. And beyond lab tests, there's a whole suite of radiographic examinations and imaging techniques available now. We're talking standard X-rays, probably the most common, showing bone structure really well.
The go-to, yeah.
CT scans, which give these detailed cross-sectional images, like looking at slices, ultrasonography, using sound waves, great for visualizing soft tissues. Nuclear scans, specifically bone scans, which can detect really subtle changes in bone metabolism, things X-rays might miss.
Very sensitive.
And MRI, magnetic resonance imaging, which is fantastic for looking at soft tissues like ligaments, tendons, cartilage, muscles. And there's also DXA, which stands for dual energy X-ray absorptiometry. That's used specifically to measure bone density, mainly for diagnosing osteopenia and osteoporosis.
That's the gold standard for bone density.
Oh.
And for even more direct insight, sometimes biopsies of both bone and muscle might be needed. That's where a small tissue sample is actually taken out and examined under a microscope.
Okay, getting a direct look at the tissue.
Exactly. And finally, there's arthroscopy. This is a fascinating procedure because it can be both diagnostic, figuring out what's wrong, and surgical, actually fixing the problem at the same time. It involves inserting a thin fiber optic tube, like a tiny camera, directly into a joint, often the knee or shoulder, for direct visualization. You can see everything right there on a screen.
Wow.
This type of procedure involves careful patient preparation beforehand, the procedure itself, obviously, and then thorough post-care instructions to assure proper healing. It's truly incredible how far these tools have come to let us see inside the body.
My mind is just, well, absolutely blown by the sheer intricacy we've uncovered today. Seriously. We've journeyed from the fundamental building blocks of the musculoskeletal system, the cells and tissues, to its complex functions, the dynamic processes of growth and aging, and then all these thorough assessment methods used to understand its health. It truly is a testament to nature's design, isn't it? From the smallest cell building of bone to the complex diagnostic tools that let us peek inside.
It really is. And this knowledge hopefully is incredibly valuable for you, our listeners. Whether you're trying to understand your own body better, maybe navigate medical conversations with a bit more confidence, or simply appreciate the incredible design of human biology, it affects us all.
It truly is a marvel. So we'll leave you with this thought to ponder today. Given how essential and, well, complex our musculoskeletal system is, what everyday habits might you reconsider or maybe start to better support its long-term health and resilience? Keep that curiosity going. Keep exploring the amazing systems that make us us.